the full weight of it, I think, is really taken its toll. But it's through coming together like we are today that we can find conversations and really discuss and figure out a way forward. So we're grateful for you joining us all today. Before I formally introduce the Congresswoman, I would like to have Alex Lewins-Wordling, my colleague at Root Cause Coalition, who handles our research, just lift up a few key points on our recent maternal health research. She'll be doing a deep dive into the data later on in the hour, and we certainly welcome any and all who are able to join us and interested in doing so to hang on. But clearly the bulk of the time we want to give to the Congresswoman. So before I formally introduce her, Alex, I'm going to have you maybe lift up a few key points from that research, and then we'll get the conversation underway.
Sounds great. Thanks so much, Barb. And hi, everyone. And thank you so much, Congresswoman Underwood, for joining us today. As Barb mentioned, I'm just going to share a few key points with the bulk of the report being at the end of today's webinar. But I thought that these points would really just help set the stage for the Congresswoman's discussion and presentation. And this research was actually just released this morning, so it's hot off the press. And it's focused very squarely on maternal health and the intersection of maternal health and social determinants. And just a few key points before we turn it over to the Congresswoman. I thought these were just so striking based on the results that came back. So as we think about the term maternal health, we wanted to know how familiar Americans were with the term maternal health. This is a survey of 1,000 adults 18 and over. It's nationally representative. I'll go into the demographics a lot later, but just know by and large, 1/3 of Americans are totally unfamiliar with the term maternal health, right? Look at that blue part of that pie graph. And then you have another 40% saying that they're only somewhat familiar. If we give the definition of maternal health according to the World Health Organization to survey participants, you see that fewer than 1/3 believe access to quality maternal health care is adequate. So you see that dark green where you say 30% say it's totally adequate, 37%, so over 1/3 say sometimes, and then you see 20%, 1 in 5 saying it's totally inadequate. And then we also talk in the survey a little bit about WIC. We ask a couple of other questions related to WIC that I'll share later, but I thought this one was particularly important. We give a little bit of a setup about what WIC is. It's at the bottom of the slide and you'll see there. And we see, importantly, as we think about the policy implications of maternal health, over half of Americans are extremely supportive of WIC. So again, look at that dark green part of the pie chart and you see 51% say they're extremely supportive, and another 21% say that they're supportive, and then that 19% is that neutral, middle of the road. And that's it. That's what I wanted to share today. I will turn it back over to Barb, who will formally introduce Congresswoman Underwood now.
Thank you. And like I said, I thought those few key points would really help set the conversation. But now I am so happy and honored to formally introduce our special guest and speaker this afternoon, Congresswoman Lauren Underwood. Congresswoman Underwood is the first woman, the first person of color, and the first millennial to represent Illinois' 14th congressional district. She's the youngest African-American woman to serve in the United States House of Representatives. She serves on the House Committee on Veterans Affairs, the House Committee on Appropriations, and she co-founded and co-chairs the Black Maternal Health Caucus, which elevates the nation's Black maternal health crisis and advances policy solutions to improve maternal health outcomes and end disparities. I really can't think of anyone better to have the conversation with this afternoon. Prior to your election to Congress, you served as senior advisor at the U.S. Department of Health and Human Services, helping communities across the country prevent, prepare for, and respond to disastrous bioterror threats and public health emergencies. You helped implement the Affordable Care Act and work with Medicaid plans in Chicago to ensure high quality, cost-efficient care. Congressman Underwood, again, we're so grateful for your work, your leadership, and we're honored to have you with us today. You said that you'd like to have this be a fireside chat format, so I will ask our audience participants to please not be shy. Put questions into the chat, and we will try to get as many as we possibly can. But I'd like to start out the conversation, if you don't mind, and just simply pose the question, can you talk about your work in addressing maternal mortality and what your policy priorities are for this year that you hope can help close the equity gap?
Yes, well, Barb, thanks for having me. I'm so pleased to be with you. We know that obviously we have a crisis in maternal health in this country, and driven by the disparities that we see for Black and Native American moms. Native American moms more like two times more likely to die. Black moms 3 to 4 times more likely to die of pregnancy-related complications than their white counterparts. And for every death, we have 70 near misses. So it's this dual crisis of morbidity and mortality. And so we developed a comprehensive solution, the Black Maternal Health Omnibus Act, 12 bills to comprehensively address this crisis. It's not duplicative of other legislative efforts. So for example, the postpartum Medicaid expansion, which I fully support, is not in the Omnibus. We're working in parallel to get that a mandatory year-long postpartum Medicaid expansion signed into law as we work to get these 12 bills through the Omnibus signed into law. Social determinants for moms like housing, transportation, nutrition assistance, WIC, to your point. We have mental health and behavioral health issues that are being addressed through our Moms Matter Act, expanding access to telehealth and digital tools, right? We have COVID-related bills within the Omnibus, given what we have seen about maternal vaccination, and some of the barriers to including pregnant, postpartum, and lactating people in clinical trials. So that's in the Omnibus. We're really excited to continue to advance that. The other piece I think is really important to the discussion is just the overall health status of our communities, how we can more equitably make sure that the American people are accessing affordable, high-quality healthcare. And my Healthcare Affordability Act was signed into law for 2 years as part of the American Rescue Plan, that most recent COVID relief package that was signed in March of 2021. It says that no American would pay more than 8.5% of their income for silver-level marketplace plans. And so those are plans that have, comprehensive coverage, not the high deductible plans that folks don't want. These are really attractive plans. And since that was put into place, we've seen 14.5 million Americans enroll in marketplace coverage, most for the first time ever. 4 out of 5 enrollees have found a plan for less than $10 a month. And we have the lowest number of uninsured Americans right now than we've ever had in US history, thanks to this legislation. We're trying to make it permanent. We don't want to see folks' costs rise so dramatically that now their healthcare is once again out of reach. So those are my 2 key healthcare priorities in this environment. And I think that both make a big impact on maternal health.
Absolutely. And those are huge priorities for our organization, Root Cause. Our mission, our goal is really to achieve health equity for all. You mentioned so many of the key areas and issues that we very intentionally lift up. We track on what we affectionately call our ELM, or Equity Legislation Monitor. What else can organizations with 90+ cross-sector members and other organizations, individuals who are on this webinar today, what can we all do to help lift up and continue to ensure your success so that the American people can really achieve that health equity?
Well, I know how important the Root Cause Coalition is, and that your members are health systems and businesses and nonprofits and other organizations that have a presence in every state across this country, which means that your organizations and individuals as leaders within your communities should be making your voices heard with my colleagues, the representatives and senators in the United States Congress. I think that advocates often assume that members know about great pieces of legislation like the Omnibus. And, quite frankly, many of my colleagues don't know about the bill, and you would be the best messenger to tell them about the need for the Omnibus and how it would impact and improve care and outcomes in your community. And they'd be much more likely to listen to and believe you than they would even listening to and believing me. And so we have to work together. And I think that, many folks assume that, elected officials might be too busy to visit with them or to visit your organization or clinic site or whatever. I would make those invitations. We're heading into the summer months. Every elected official is going to be home. They're going to be looking to fill their days with site visits. And who does not want to take a great picture in a healthcare setting or with some engaged community members talking about saving moms' lives? I mean, this is really easy. So you'll be able to capture them and engage them. And I would just encourage you to lean in and do that. Don't opt out. There's too much at stake.
Absolutely. So much at stake. And we will continue to lift up what you're doing and again, work with our members, because you said it, we are all in this together. We need to help spread the word. I'm going to ask my colleague, Tom Dorney. I know that there are some questions coming into the chat. Tom, if you could share with us maybe a couple of them that came in right up at the top.
Sure. So first question is, we do not have federal paid sick leave or paid parental leave. Are these part of the Omnibus legislation?
No, the paid leave provisions are not in the Omnibus. I am fully supportive, but those had already been introduced. So the Omnibus is not duplicative, meaning that these are new policy proposals explicitly designed to address the leading causes of maternal death in this country. And so while we know the importance of paid family leave, we know the importance of paid sick leave, that is not within those two criteria. And so we work in close partnership with our colleagues in the House to make sure that we can advance those bills. As you know, we have advanced the paid leave, in particular paid family and medical leave is what they're now calling it. And then I've introduced a bill called the Job Protection Act, which is different. It's not in the Omnibus, but it's related because people who take their FMLA leave can still lose their job. And so so as we work to expand, we need to have the job protection piece in place. Does that make sense?
Absolutely.
Okay.
Absolutely.
Yes.
Excellent. A question on what's the latest on what Congress's action around formula shortage?
Okay, so we passed two really important bills on the infant formula shortage. The first is to expand the participating and eligible brands that the WIC enrollees can purchase using those benefits. That passed with broad bipartisan support and has been signed into law over the last week by President Biden. So the WIC changes are going into effect. What the congressional Republicans did not support was the funding to turn up the production and increase access to this formula. So, we've heard a lot of sharp partisan words around how we got to this place of an infant formula shortage. And it is just so disappointing that my colleagues on the other side of the aisle would not offer the type of funding that is needed for FDA to be able to do this work, to expand access to infant formula in this country. So we are still looking for opportunities to increase the funding to solve this problem.
Right. Well, the Black Maternal Health Caucus has a great website with a lot of updates. There's a question about where to get information about your work and the work of the caucus. So I will shout that out, but I want to give you the opportunity for you to direct folks anywhere else that they should be.
Yes, you can follow us on Twitter at BMH Caucus. Again, at BMH Caucus, CAUCUS. And that's where we have really timely information that gets you acclimated to what's going on in this whole maternal health space. And then there's obviously our website, bmhc-underwood.house.gov. And that's where you can get the fact sheets about the individual Omnibus bills, the cross-reference on what was in our big reconciliation bill, Build Back Better, and what's in the Omnibus, like that kind of stuff, is a everlasting resource for you to be able to peruse who the members of the Black Maternal Health Caucus are. We are one of the largest bipartisan members in the caucuses in the Congress. And if you want to verify that your representative is a member of our caucus, you can visit our website to do that.
That's excellent. And your all-star staffer, Jack, has already put that
Jack
in the chat
is the
for folks.
Best.
He's
Let's
on.
give him a shout out.
Another question. Could you talk a little bit about how the maternal health issues have evolved during the pandemic and sort of what you've seen pre-pandemic versus kind of where we are today?
Yes. So, there's been a real clear impact of the COVID-19 virus and maternal health outcomes. So early on, what I call stage 1 COVID, we saw some data from the CDC's MMWR, the Morbidity and Mortality Weekly Report, documenting that Black and Hispanic moms were more likely to get, or, pregnant people were more likely to get severe illness if they got infected with COVID while they were pregnant, and then they were more likely to have negative birth outcomes. And so that really inspired our work for the COVID-related bills, the Maternal Health Pandemic Response Act that I introduced with Senator Elizabeth Warren, and then the Maternal Vaccination Act that Congresswoman Terry Sewell introduced that has now passed the House with unanimous bipartisan support. So we see that more likely to get sick, severe illness requiring hospitalization, negative birth outcomes, but then we're also seeing that there was a lag in including pregnant, postpartum, and lactating people in the clinical trials. It's a problem because it created all this confusion around whether the vaccine was recommended for pregnant people, postpartum people, breastfeeding people. There was a problem around the treatments, right? They weren't included in the clinical trials for the treatments. And so it slowed down the rollout and the availability of these novel treatments for a pandemic, a virus that had turned into a pandemic. And we can't let that continue to happen, right? We need to be thinking ahead, planning for the next emerging infectious disease and making sure that this vulnerable population is included so that we have clear recommendations and can fight back against the misinformation and disinformation that we know is targeted to our expectant and new moms to make sure that they can make great healthcare decisions for themselves and their families.
That's wonderful. There's a great interest in the chat around just folks kind of wanting to know the landscape of organizations, who else is sort of working in this space, or again, we'll direct you back to the Black Maternal Health Caucus website, but is there any other sort of areas, any other kind of indicators, sort of areas that you're looking at that you keep an eye on, that you keep tabs of, that are important to you as you're sort of thinking about the space in total?
Well, we've been really fortunate to have a great and very diverse stakeholder community, everybody from leading researchers and academics who have been doing this work. And so then, it's really enabled us to have evidence-based policy solutions, right? Because we are drawing from a wide, broad, thorough biomedical evidence base to support these policy proposals. We know they'll work. We have great providers and provider associations representing really all of the players in this space are supportive of the work that we do, which means that we don't have this kind of conflict among specialty groups, among healthcare providers. Everybody's focused on this goal of saving moms' lives. We are working with industry experts and industry leaders like some of the leading consumer companies that you're all very familiar with, to, novel or more intriguing, like Uber and Lyft, who want to help get moms to their appointments. We have, Pampers and Huggies and, like those consumer type products who are very engaged. And then leading organizations like your coalition, like the March of Dimes, those types of groups as well. So I would invite anyone who's interested in being part of our larger community to sign up on our website. You can also send us a note there. And so then we'll get you on our email list when we have announcements and, gatherings. We had a big stakeholder summit in Washington, D.C. As the Capitol reopens to visitors, we look forward to bringing folks together again. I think we have a lot of opportunity to touch base. I'm seeing in the chat that the sign up is not working. And so we're going to help you with that.
It is working. It is working. It is working.
Okay, good. And it's been fun to be able to connect with people coast to coast. And even internationally, I have to tell you, we had a member of parliament come and visit us from the UK because they have the same type of disparity. And so, institutional racism, systemic racism is not just an American phenomenon. And so we have an opportunity to make an impact on a global scale.
That's great. So you brought up a really interesting point in your comments just a few moments ago about all the organizations that you've been working with. And, we pride ourselves on being a cross-sector organization. What are some of the lessons you've learned from gathering people with a common cause and some of the maybe lessons learned to avoid or to focus on
Sure.
for
You
all
know,
of us as we work from different sectors?
one of the things I've been really intrigued by is that everybody has a connection to this work. And people who may not be from racial or ethnically diverse areas are also deeply passionate about this work, because the mission of saving moms' lives is universal, right? And so I would just say, the data from your report can be very instructive. The language that we use in talking to one another, maternal health, birthing people, right? Some of the clinical terms for the leading causes of maternal death. Those may not be accessible phrases for an average community member or a partner who is less fluent in the nature of this issue. So even using words like morbidity, severe morbidity, mortality, right? You can talk about moms dying in childbirth, or having severe complications, right? Always being clear and translating to be inclusive. Because what we don't want to do is have a insular conversation and leave people out. And I think that that's the biggest lesson learned, that 9 times out of 10, people want to help once they learn about the problem. They think it's outrageous. It's 2022. Why are moms dying as a result of childbirth in America?
That's right.
And so, we can operate from a space of, welcoming people. Let's just be thoughtful about the words that we use in that broadest audience to make sure that this is an accessible conversation for everybody.
And that's a point that we've really focused on in all of our research that we do, these monthly pulse surveys. The reason we do them monthly now is because about a year and a half ago, we realized after surveying 1,000+ people, they don't know the words that we're all using every day. To your point, morbidity, mortality, and nothing is more important than meeting people where they are and making sure we're representing the voice of the people who we are trying to, improve everyone's opportunity to live a life of well-being and health. And so language matters, words matter. And I think that's a point really well made. And that's why, the 3 slides that Alex showed at the beginning, I think are so, really, they hit home on the work that needs to be done, not just in the awareness building, but how we're using our words to describe that.
That's
Tom,
right.
I know there's some more questions in the chat. You want to go with the next one?
Yes, the Congresswoman is clearly a wonk. She's got the background. So I've got a question on data. What data is most helpful to advance maternity health issues? Where should we be looking? Kind of where do you see those gaps?
So what we find is that there is a lag in national data that becomes available. And so meaning CDC is always a little bit behind in being able to report out that national data. So if you are with a healthcare system, if you are with a health insurance company or some type of, offering coverage to folks, if you have access to timely data, making that publicly available in any form is so helpful for folks to be able to spot near-term trends and, especially even in a small geographic area. It's important because what we find is in this space, the legacy organizations tend to be place-based. Those communities that have had a long time struggle with maternal mortality, there's often grassroots groups or provider networks that have been working on this issue for decades, right? And if they are just solely reliant on national data that's 2 or 3 years behind, right? They are constantly playing catch up. And so what we try to do is with the stakeholders that we work with, particularly these companies, we try to get them to make public commitments to release information or public commitments to do something. So it's not just a conversation between the Congress and them, but it's one that can be inclusive of community leaders so that we can all take action together in a collaborative way.
Yeah, great. Let me ask one more question. It's amazing how quickly the time goes, and we would love to have you back. And again, we will continue to lift up your work. Given everything, like I said at the top of this conversation that's gone on this week, the last few weeks, months, years, this is the week of the 2nd anniversary of the murder of George Floyd. What do you have as kind of your North Star, and what are you most hopeful for as we all work to achieve health equity in the face of everything that we're dealing with?
Yes. I am excited that this is an area that's been able to break through some of the partisanship that we've seen take over when we talk about disparities, we talk about equity. You know, my colleagues across the aisle like to talk about wokeism or cancel culture or whatever, right? And as in an effort to discredit and dismiss and shut down conversations around inequities in this country. And this is something that I think breaks through all of that. And so obviously our legislative horizon is a little bit dependent on a couple key senators who may or may not decide to support us in this mission, but we know that we have the support of the American people and that we're able to have a compelling, emotional, sincere, genuine conversation with people because they are invested in us having a successful outcome. Once we're able to use the words to connect with people, they are all in, right? Like who can deny the need to save moms' lives in this country? And so that gives me hope.
Well, you give us hope. I can't thank you enough for sharing this half hour with us. It's been great to have you. We would love to have you back. And more than anything, thank you for what you're doing on behalf of the American people, and especially moms who parenthood isn't easy, motherhood is not easy. We need to make access and affordability and equality there for everyone. So thank you so much for being with us this afternoon.
Thank you. Take good care, everybody.
Yeah, you as well. And for those of you who can stay with us for the next 20, 30 minutes or so, I would like to turn it over again to my colleague, Alex, to go through the information on a deeper level, if you will. And Alex, I'm going to kick it right over to you so we can get right to that information.
Perfect. Thanks so much. That was such an interesting discussion. And I think so relevant to a lot of the issues that all of the root cause membership is working on every single day. And hopefully the data that we generate is helpful from an advocacy and policy perspective as well. So most of you were probably on at the top of the hour where I shared just a couple of top line findings, but I want to spend at least 15 minutes or so just taking a little bit of a deeper dive into the maternal health research. Barb mentioned that we've been doing these monthly Omnibus surveys. They're nationally representative, 1,000 adults 18 and over. We have surveys going back a year now or more even on topics ranging from climate to SNAP to WIC to COVID-related behaviors and concerns, and a number of forthcoming studies coming out, one related to food allergies, one related to housing, a lot of really interesting topics in the work. So stay tuned for those as well. Also know that all of our data is entirely available for free to download. It's posted on our website. The research that was released this morning is under our research tab, and there you'll find both the release and the report. So feel free to use the research. That is the entire point of it. We don't want it to live on our website. And if you need the findings in a different format, please let us know that as well. So with that, I'm just going to share my screen and walk through some of the findings from the report, and then hopefully have time for some Q&A at the end if you have questions about the research. So I mentioned this slide already, but in case you weren't on earlier, I think it's just a really interesting level set that we have about a third of Americans unfamiliar with the term maternal health. And you'll see following each kind of general slide, there's a demographic breakdown. So we capture gender, we capture race, we capture age, region, income, whether or not an individual is college educated, parents versus non-parents, and then urban, suburban, and rural. And if you see a blue percentage, that means it's significantly higher than the other percentages within that sub-demographic, and conversely red, significantly less than the same, than the percentages within that same sub-demographic. So here you can see among those who are very familiar with the term maternal health, more significant for those who are under 45, for those who are higher income earners, college educated parents, and urban. These are demographics that tend to track closely together over multiple studies. So it's just interesting to see it here again. Okay, is maternal health care adequate in this country? And here you can see 20% say no, it is totally inadequate. And then another 37% say sometimes it depends, and less than a third say yes, it's totally adequate. We use the definition of the WHO for maternal health, just kind of level set how people think about it, since it was just not a well understood term. And here you can see, once you provide the definition, that there's a large percent of the population that thinks that maternal health is not adequate. And then this is not at all surprising, but here you can see compared to the average, females are significantly more likely than males to think that maternal health care is inadequate. About a quarter of females think that it's entirely inadequate. All right, so why, what are the reasons why maternal health care is either sometimes adequate or totally inadequate? That was the filter for this question. And as you can see, there isn't actually one thing, which is not surprising, but it really is multiple layers of issues and factors. And here we had participants rank their responses 1, 2, and 3. And so the dark green is like number 1 rank, lighter green, number 2 rank, and lightest green, number 3 rank. And you can see it ranges from it's unaffordable, it depends on your job, depends on where you live. To a lesser extent, depends on your race, at least perceived, depends on how much time you have to find care. And then less than that, depends on your education level and sexual orientation. Okay, when you look at the demographics, a lot of them don't have significant differences, but I thought this was an interesting call out. When you look at the responses related to access to quality care depends on your race, you see double the percentage of Blacks compared to the average, which is 12%. 24% of Black individuals believe access to quality care depends on your race and ethnicity. Who is responsible for access to quality maternal health care? Again, this really cuts across multiple different entities and institutions. But I think the takeaway from this slide is that there's this large sense of responsibility large sense that policymakers, from the president, state and local governments, and Congress, and federal government agencies, are responsible for access to quality maternal health care. If you look at it compared to hospitals, for example, presidents, state and local governments, and Congress are all up there compared to what you'd naturally think people might respond with hospitals. So again, this overwhelming policy sense. And then here you can see some of the demographic breakdowns. I think one of the interesting pieces to look at is just this policy element. So if you look at it within president, Congress, federal government agencies, you see parents believe that the president is significantly more responsible than non-parents. Congress, males versus females. Hospitals, you can see those who are younger compared to those who are older. So there are some interesting call outs, but by and large, this is something that straddles across some sub-demographics. All right, so now we get into how people perceive government programs. So at the bottom of this slide, like all the slides, the question is there: to what extent are you supportive of federal government programs that provide food and nutrition assistance to lower income individuals and families? And you can see here, and I think this is important from an advocacy perspective, over half of Americans are very supportive and another 34% are somewhat supportive. So you have a significant majority in the supportive camp of these programs. And then, not surprisingly, when you break it down and you look at that very supportive column, you can see those who are earning less than $40,000 are significantly more supportive of these programs than those who are higher income earners. The same holds true for urban residents compared to suburban and rural. Okay. So why do you support these programs? I think this is interesting. Again, a little bit of a divide here, but you see About half of participants say that in general, they're just supportive of these types of programs. And then another 44% saying that I believe the need for food and nutrition assistance is greater now because of the pandemic. So clearly the COVID-19 has had a role in perceptions and need around these programs. Okay, and then again here, the demographic breakdowns. I think the most interesting column is in the middle where you see a couple more highlights. I have personally benefited from these assistance programs. You can see females significantly more than males, and you can see those who are lower income earners significantly more than higher income earners, and then non-college educated compared to college educated. So it kind of tracks the way that you might expect. All right, couple of questions related to WIC. We wanted to get a little bit of a baseline here around familiarity with WIC. So we just asked a very general question, how familiar are you? And you can see here about 4 in 10, 39% say they're very familiar, and another 40%, roughly the same percentage, say they're somewhat familiar. About 1 in 5 say they're unfamiliar. And then when you look at the demo breakdown, again, it tracks relatively closely to probably what you'd expect, where you see Black individuals, 60% say they're very familiar, so significantly higher than the average, 39%. Those who are younger, those who are parents, which is not at all surprising, and those who live in urban areas. The urban, suburban, rural is a split, like I mentioned earlier, that we see often, and I think is worth exploring down the road a little bit further to better understand some of the differences in neighborhood and how it shapes your opinion and perception and just general access to services. And then I think this one is also pretty striking from a policy perspective. Nearly half of Americans know a WIC participant. So the question was, do you know anyone that participates or has participated in WIC? And you can see here, 47% say that they know somebody. I think that's pretty striking. And then here, the breakdown, 61% of Black individuals say that they know someone who has participated in WIC, and over half of those under 45 years of age, half of those who are non-college educated, and 67% of parents. Those are high percentages, especially for a program that has room to grow in the sense that there's more eligible individuals than there are participants. Okay, so then we give a little bit of a primer on WIC, which you can see at the bottom of the slide. And we say, essentially knowing this, how supportive would you be of WIC? And over half say that they would be extremely supportive, and ranked 4 on a scale from 1 to 5 is another 1 in 5, 21%. So taken together, you know, you have nearly 3/4 of individuals saying that they're at least somewhat supportive of WIC. And then here's the demographic breakdown, where you see the extremely supportive camp is significantly higher for those who are lower income earners. And then last question, if you're female and have a child in your house under 18, so we asked this question, thinking about your experience as a parent, what do you believe society should prioritize for new mothers? And here, I mean, you just see so much need across so many different issues. So we asked participants to rank their top 3. And you see access to nutritious, affordable food, affordable childcare, paid maternity leave, mental health services. I mean, so many of these issues clearly resonate, but a couple of them do stand out: nutritious food, childcare, and paid maternity leave. And then lastly, there's no red or blue on this slide, which I think just speaks to, like, there is a need for this across the board. There isn't a particular demographic that it's so needed for that it stands out, but it's just one of those issues that that cuts across demographics. And then just so you have it, this is in our full report. We always list the sample size for the demographic breakdown. Like I said at the outset, if you need the data packaged in a particular way, please do reach out to us. Our goal is to get it out far and wide and used for multiple purposes. So please do reach out with any questions. And with that, I will stop my screen share and turn it back to Barb. And I think we have some time for Q&A as well.
Yeah, that's great. And Tom, I know, has been monitoring the chat as well. Thanks to so many of you who stayed on to listen to that deep dive. And again, thank you, Alex, for all the work that you put into that. Maybe before we go to questions, just a quick reminder for those of you who don't currently sign up to our for our weekly newsletter, please do so. There won't be one this week. So I invite you to sign up for one that won't be there this week, but we do a weekly newsletter. Because of the Memorial Day holiday that we have the week off, but I think you'll find a lot of information, a lot of links to not only the information that Alex just shared, but a lot of work going on around the country from many different organizations, many of our members. And then we also have a national summit coming up this October in Minneapolis that we would love for you to attend. You're going to hear from a lot of amazing speakers. We have Keith Ellison, the Attorney General for the state of Minnesota, as our initial keynote on Monday morning. And we have a couple of other major announcements for speakers coming up. But honestly, our member breakout sessions and poster sessions are just incredibly full of information and sharing. And one of the things that we founded ourselves on is to help people not have to duplicate work. So wherever you are in your journey and whatever you can share helps others not to have to start at square one. So you'll find all of that information on our website, how to link to or sign up, I should say, for the newsletter, more information about the summit, our equity legislation monitor, which I referenced when we were talking with the Congresswoman, is also on our website, and that is updated very often. That is not a static document. So we really try and update it, not only with key legislation, but research that is relevant, white papers, anything in these 7 areas that are the focus for the ELM. So with that, I will ask Tom if there is a couple specific questions that he would like to share with Alex.
Just requests for the data and for the slides. And so we've put Alex's email in the chat. One comment in the chat is the familiarity with WIC and support of it are surprising, given that half of all families who are eligible for WIC are not participating. So
I agree with you, Michelle. That is surprising. And familiarity does not mean intimately familiar, nor does it mean you're a participant. So I think there's a higher level of sort of general sense of I've heard of it, I think I know what it is, than there is obviously of eligible participants actually participating, since we know that there's quite a bit of a gap there. I also saw a question in there about state level data. This is a 1,000-person survey. We do have the state level data, but it's hard to draw conclusions because the sample size gets very small. So we keep it at a regional level to make sure that the sample size is robust enough to pull out the data significance.
Good. Tom, any other questions that I know? Hannah, thank you for putting the links in as the questions were coming in.
Well, I think one of the last things I would just say is that keep an eye on our website and our newsletter. We're going to be doing a similar event to this in the future with another member of Congress. That information I'm going to keep as embargoed, but it's a health equity leader. We're just trying to situate the date. So, but look out for that. We're hoping for another event like this in early June. Another comment that came in. This attendee works around removing barriers, and it seems to her speaks somewhat to the cumbersome application process or the perception of the difficulty of accessing the benefit.
Yeah, I think I wrote in the chat, but I think that's exactly right. There's this gap of eligible participants and participants, as we know, in WIC, even more so than other programs. And so for those of you who are working directly on simplifying the application process and now eWIC, I think some of those changes, particularly with EWIC, will hopefully be helpful in the participant level of eligible folks.
Great. We just put in the chat where you can sign up for the newsletter. So you can just click on that, save yourself a step by going to our website. If there's any other questions or informations, again, I'm really delighted that so many of you were able to stay with us for this information. I would also say if there are topics that you think would be of interest for us to do these monthly pulse surveys on, you know, we do them every single month. Are already looking at next year. We're doing one in the next month or so on safe housing and really what that term means, and doing a very deep dive on that one as well. So all of these issues really do connect. You'll also see on this week's current issue in our newsletter links to the White House Conference on Hunger, Nutrition, and Health that is happening for the first time in over 50 years. This September, there are regional listening sessions, and you'll find a link on how you can sign up for those. So encourage you to, you know, go to the website, take a few minutes, and you know, it's for your use, and we design it that way. So hope that you'll find it beneficial, and certainly appreciate comments and feedback. Alex, any other closing thoughts, or Tom, any other closing thoughts before we?
Just a thank you to everybody, as Barb said, for staying on and listening. And we post the report as a PDF, but I know for some of you who wanted in presentation, just let us know. We'll send it to you as a PowerPoint. It's no problem. And then hopefully makes it a little bit easier for you to share with different audiences. So just let us know. And of course, reach out with questions or topic ideas, as Barb said.
Great. All right, everyone. I hope whatever your plans are for the long holiday weekend, you stay safe, stay well. Thank you for being with us today, and we look forward to seeing many of you soon on future webinars, and appreciate your presence today. Be safe, be well.